in the mouth and the throat, typically, we see a lot of viral infections and bacterial infections. You can see here, these are the tonsils on the side. When they get infected, you will see these white spots developing on both the tonsils. This is a bacterial infection of the tonsil. When you get a tonsil infection, you will typically have a severe throat pain. You will not be able to swallow water, food. You will have difficulty in swallowing. You may get fever associated with it, which stays for about 3 to 5 days. And it is typically aggravated by having something cold, etc. It is viral and it is fungal. A viral throat infection is a throat infection which is caused along with your common cold. So it's one of the most frequent infections happening in the body. So when you get a flu, when you catch a runny nose, cold, along with that you have some throat irritation, throat pain, that's typically a viral infection. Most of the times it is self-limiting, meaning you don't actually need to take any antibiotics for it. Okay, you just need some symptomatic treatment, some gargles, and it settles down on its own. And the other infection is the bacterial infection, where we see a pharyngitis or a tonsillitis, where you need antibiotics and proper gargling for the infection to get better. So if it's a viral or a bacterial infection, you may have pain, you may have difficulty in swallowing food. It may be associated with pain or it may only be a difficulty. Okay. You may have a change of voice sometimes. You may get a lot of cough associated with it. And a lot of times you have to clear your throat frequently. So it can cause irritation in the throat. Another thing that we commonly see in the throat is actually laryngopharyngeal reflux. So this normal throat irritations which happen in the throat, they may not necessarily be an infection. They might just be an acid reflux induced irritation in the throat, which is one of the most commonly things we are seeing every day these days. Most of the times it's not serious. It comes and goes. It gets better on its own. Most of the times it's a viral infection, so it doesn't require any major management. You just give some symptomatic management and you're okay. If it is associated with lifestyle and diet, it's usually acidity induced. So you change your lifestyle diet, then the frequent throat issues get sorted. But if it's a bacterial infection of the throat, then you actually need proper medication to actually kill those bacteria so that the infection goes away. If it's, say, untreated for a long time, then, it can cause an abscess where pus can form inside. It can spread into the neck, etc. So bacterial infections are something that need to be treated with a priority and with caution. If you're having frequent issues with your throat where it gets irritated very, very frequently, then most of the times you're not dealing with an infection, you're dealing with a lifestyle issue. That's why it's happening so frequently. So you need to reduce oily, spicy, and fried food. You need to reduce tea and coffee intake. It dries up the throat a lot, which causes more irritation in the throat. You should avoid lying down after eating anything for 2.5 hours. You should not skip meals. You should have small and frequent meals. Drink more water, about 2 liters at least every day. Tobacco, alcohol consumption should be kept to a minimum. And stress, anxiety also plays a role in increasing the acid reflux, which in turn affects the throat. So these are the few things which are in your hands, which you can change, and that makes a difference. And also, if you are somebody who speaks a lot in the day, then you should take care of your voice also. Like not shout too much, use a mic if you're addressing a big audience for a long period of time. Drinking lots of water in between a long presentation helps. If you're a professional voice user, if you're a singer, if you're a teacher, for example, then you need to meet your ENT regularly to see how you can take care of your voice. And my message would be avoid self-medication, especially with antibiotics, as much as possible. Because we're seeing a lot of misuse of antibiotics happening right, left, center for every throat infection, which is really not needed most of the times. You have to consult your doctor and not try and treat yourself. Never take an antibiotic on your own over the counter from over the chemist directly. At least before starting antibiotics, you must see your physician or your ENT. And for home remedies, you can do some gargling, warm salt water gargling. You can use betadine gargles. You can avoid cold foods. You can have more of warm fluids. You can take steam inhalation for a few days. You should ideally not speak too much. The lesser you speak, the more time, the faster the voice box and the throat will start healing. So those are a few things you can try. You can take some antihistamines over the counter for the cold, etc., and you see how it is. But if it is worsening after a day, or if you're getting fever along with it, or say the pain is very very severe, then you must see your ENT before you medicate yourself.